all the three muscles. So all the three muscles will start from here. Biceps will come here, but membranous and tendons will come here.
Okay, so when you touch like this, very easily you will identify the semitendinosus because the hard tendon, no? So this is the tendon. Just below the tendon, this part. Can you see this part? Oh, this is big trigger point. Now you see, just do like this. Have you find the dip? Okay, which is the most sensitive finger? No, always try to diagnose through that finger.
Trigger point, you mean when the fiber is open, no?
Yeah, they open. There are many different trigger points. Yesterday we discussed. Somewhere the fiber are the more stiff. What we are targeting the weak fiber, which is the broken fiber. So to bring the more fascia. You fine?
Yeah.
Yeah. So which is the most sensitive finger in this of a 5 finger?
This one.
Index finger. Why?
More nerve endings.
No, because of nerve connection. No.
Because it's near the thumb.
When we go hospital, always doctor check the oxygen. In which finger they check?
This is
Why
air
only the index finger?
point.
No, he's check on this also.
Concern to
Mostly
lungs.
they check on the index finger only.
The-
If someone check like this, maybe he was like nurse or maybe not the doctor. In Ayurveda also we have the 3 finger, Vata, Pitta, Kapha.
air
This is the
is
Vata finger, this is the Pitta finger, this is the Kapha finger. When we check the Nadi, so in that times we check the Vata, Pitta, Kapha. So this is the Vata finger, this is the Pitta finger, this is the Kapha finger. When we are checking the Nadi, the patients, because there is only one artery, the blood flow is only one. So how the blood flow will change here and here? Okay, blood flow is only one. That is the sensations we have to diagnose it. That is more important our finger. Got it? So our finger will detect the Vata, detect the Pitta, detects and the Kapha detects. Okay? Because in the Nadi there is only one flow, no?
Yeah.
There is only one radial artery. The flow will not change here, here, here.
Yeah.
Okay? That's more important. That's in your finger.
So this is the Vata finger.
Yeah. So this finger is more. When people are doing meditation, chanting, they are holding which finger?
Either.
Like this. So when you are counting about the like 5 element, so ether, air,
Yeah.
okay, fire,
Fire,
and
water,
and
earth.
So when you are doing like this, you are controlling ether and air. So vata dosa is comes from 2 element, which is ether. Ether means the space. Between me and you. What we have?
Space.
And in space, what we have?
Air.
Okay, so when we are holding these two, means we are controlling more movement inside our body. We are controlling the thoughts. So that will be easy for you to do focus on in one subject. Okay, so that's why the people are. There are different mudras for the different element and this also. Okay, but this is the to control the movement of the gans, because when the vata is moving too fast in your brain and body, many thoughts are going on in your body. There is like brain is working only. When vata is balanced, then you can meditate, you can focus properly deep. Okay, you all check the trigger point because you use big trigger point, right? So now we'll go in this trigger point, and this muscle is more deep muscles, very use big muscles. Okay, we'll go in these muscles. Have you seen yesterday anyone like when we insert needle, the muscle was giving the like a shock?
Yeah.
Now after the skin, okay, try to find 2, 3, 4 times. If not responding, then don't do many times. Okay, then relax the body. Slowly the trigger point will come on the center of the needle.
Achha, it will come.
It will come if you are very close by. Okay, if trigger point is here, you are inserting needle here, of course this will not travel till here. Okay, but just next to, then automatically trigger point will shift there. Yeah. Okay, so if you are doing 4 or 5 times, if it's still not responding, then leave it. Wait for the few 10 second, 15 second, then once stimulate again.
Okay.
Okay, if once you get this one, no, that's perfect healed.
And after that भी अगर नहीं मिलता है तो change कर देना. Maybe.
Yeah, if you're not finding, then try to change. If not, then you can leave it for this time. Maybe we'll try next time more. Okay, so this is the again tendon. Yeah, here. If you want, you can check it. Okay, go like this, then you will find it.
Okay. Okay.
Now this muscle was like very quite healthy muscle. When we tried, there was no stiffness, no weakness. So here, if you check, if you move your finger like this, no, you will not find anything. There is no deep, there is no nothing. This is just plain muscle.
Yeah. Here it is not trigger point. Here it.
There was one trigger point. Here, this is a little bit. Yeah, that was this one, and this one is. We'll target a little bit. Yeah, check this one now.
So the trigger points change depending where the weakness is it?
Yeah. Okay. So if you are going like this, no, you are using the force, so maybe it's difficult to because going away from your body. So always when you're checking the trigger point, no, comes toward of your body like this. Okay. So now if you are here, then come like this. This is the trigger point.
This.
Sometimes in one muscle there,
Yeah.
there are also many trigger points. Yesterday that old man who was sitting in that, there are many trigger points. In one muscle, 10 trigger points. Okay. So but after the one treatment, if this trigger point is resolved, then we'll go to the next one, then the next one. Okay.
This one is perfect.
Yeah, this one is that is the biggest one.
So more the fat, more the trigger points.
More weak, more the trigger points.
Not more fat.
Yesterday we discussed, no, the fat also comes in the muscles. The fat also comes due to weakness. If muscle become the weak, so muscle is not moving that all toxicity. So the fat is all accumulated in that area.
And then it can't be possible that we are treating 2-3 trigger points and then
Mostly I suggest if too much weakness, then try to insert in the one muscles only 2 needle maximum. Because if you are targeting to this trigger point and whole body's fascia will try to come here, maybe that will heal your rest trigger point. If you are targeting one needle here, then this fascia is divided this side, this side, this side, this side. So it's not that much need focus. So that's why mostly I target one maximum time 90% only one in the one muscles one needle. In this more condition, then maybe I'll go with 2. Okay. So this was the bigger one, right? This one. Okay. Sometimes patients are very intelligent and you are doing too much like this, and when they get the electric shock and you stop. The next person when you're trying, okay, they already knew you are trying to hit that one. If I say okay, yes, yes means that was the right one. Okay, so do not stop it, because when genuinely will come, no, he knows that which is the true or which is the like they are lying. Okay. This was the mild one. Now you get the one. This one is mild one. Okay. Now we'll wait for 1 more minute. Now we'll go on the bicep femoris on the right side. Check bicep femoris. So wait up. If there is needle, no, in that same group muscles, do not press too much, because needle is moving, patient is feeling little bit pain. Okay, so always trying to go more superficially. Okay. Bicep femoris. Where is bicep femoris? This is the tendon. Okay. This is the center area. Lateral side of the center area between these two.
This one.
Yeah.
This.
You confirm, guys? Is that right or no? Okay. You confirm everyone. Okay. No? Try, please try everyone. You can check this muscle. There is no trigger point to how that muscle feel. Okay. If you will press too deep, there may be not that much. Okay. This is the enough pressure like this.
So, so
I
this is
feel
the
here.
tendon.
Which tendon? No, this is the center area. This is the bicep femoris,
Yeah.
and this is the semi-groove.
Here is something.
There.
This is deep.
How is plain that you understand?
To come from under the tendon.
Yeah. So this is the tendon, and it's going like this,
Yeah, this one is pretty good. Huh?
right? That is like normal muscle. You will get good sleep now.
Concentrating on
Yeah.
It is
that's-
We
deep.
are getting this only.
Yeah, these two muscles were very weak. That was not that much, but there was
I
weakness.
think there's one there as well.
The little is
Yeah.
deep.
Does it go across?
Yeah, it's going from the hair to ischiums, which is the hair
Oh, right.
on the
Okay.
buttock.
Yeah, this one here.
Okay?
You know, not that one here.
So, okay. Yeah, one is here. It's mile 2, 3, but this one is a little bit more. Not that much, but okay.
Muscle is going like this.
Hmm?
Muscle is going like this.
Yeah. So this one too. So sometimes if there is only like one needle and you have to give the electro, so you need one moderator point, right? So you can use the small needle somewhere else on the same muscles, then you can give the electro.
And this one goes up like this as well.
This is going like this, straight. These two muscles are
Semi-membranous.
straight, and that is coming little bit of the inside.
And which
See the
muscle is
inside?
here?
That's the semi-tendinosus.
What's
The
here?
semitendon is this side.
Okay.
This is semitendon is this is tendon. This is
Okay.
semitendon is. Below the semitendon this is semimembranous is, and this is the bicep femoris.
Okay.
And what's here
So they're
then?
both this side.
That is a gap between the bicep femoris and vastus lateralis. This is the gap. Touch here. See, this is the gap, no? This gap is between the two muscles. That's normal.
Gap, you mean the bone?
No, between the one muscle to another muscle. Okay, so this is the same bicep femoris. Then this is the vastus lateralis. So between these two muscle gap, that is separating the muscles. Yeah, vastus lateralis is here, and bicep femoris. Between these two, there is a gap. It's very mild.
We went down. This is
That's why the gap was coming in it.
so the semi-membranous is under here.
Yeah, under the semitendinosus. This is semitendinosus here.
Okay.
If you feel the tendon,
Yeah.
this is semitendinosus. This
Yeah.
one, and below the tendinosus, membranous is like this.
You only feel it when it's more than
Yeah,
45.
so this is like membranous, and tendinosus is going on the top like this.
Okay.
Okay.
So here, this is the bicep.
My phone, I'll show you. Where's my phone?
So this is the biceps, right? Biceps pin.
See this one.